Welcome to the 5th UNDESA, UNPOG, and UNDRR GETI online training workshop on advancing government innovation and leveraging frontier technologies for disaster risk reduction and building resilience. My name is Anna Tornum, and I work for UNDRR Office for Northeast Asia Global Education and Training Institute in Korea. And I will be your main facilitator today. This session will be on strengthening governance and leveraging frontier technologies for public health emergencies. And today's session aims to share practical experience from countries. We will have the presentations from Republic of Korea and the Bangladesh. And also we have colleagues from the UN system who will share information and tools and the use of ICT during COVID-19. Let me first introduce our first speaker, who will set the stage of this session and make an introductory presentation, Dr. Qudsia Huda, who is the head of disaster risk management and resilience unit in the health emergency program of the World Health Organization in headquarters. Dr. Qudsia, the floor is yours.
Good morning, everyone. Good morning, Anna. I would like to share my screen.
Please.
So do you see my screen?
Yes, very well.
Okay, thank you very much. First of all, thank you very much for inviting me to speak at this occasion, at this training program. I'm very honored. And I'm going to share some of the updates from the current pandemic and also WHO disaster risk management framework, and that we use to implement Sendai framework for disaster risk reduction in the countries, and also to take a whole of society approach in managing risk in the communities. I would like to first introduce this slide where I'm showing that the situation of the world. These green dots are the natural events prone countries, and while the reds are conflict prone countries. In addition to that, the world is exposed to climate change, epidemics and outbreaks, biological, chemical, radiological and nuclear events, and food insecurity. On top of that, there are issues with migrants, refugees, internal displacement. And here comes the pandemic in the middle of all these things. The reason I'm sharing this with you, so to understand the challenges, that the pandemic doesn't come to the world in a way that the world, it's the only problem. It comes in the middle of many other problems. So this certainly warrants a change. So I would like to highlight that what are that change. So in this slide, I will show you something. I will show you that how this pandemic, when it comes to the society, what and how we use our means and ways to manage this from the governance to the communities for the benefit of the population. First of all, when it begins in any country, there's importation of cases. That's how the pandemic spread, because it's not an endemic issue. So the main issue comes then the community transmission. And when the community transmission happens and the people started to get infected, some of them, they show the symptoms. Some people, for the immunity reason, they don't show the symptom. But when the people, they show the symptoms, some actually get well without anything. And some people, they need some care. So we call it home care. And then during the home care, some people gets better, but some people need extraordinary care in the hospital and healthcare facilities. The reason I'm showing it, you will see that how the health system and healthcare links the community up to the tertiary level care. So from the hospital, we see some deaths and also many recovered. So then in the middle of all this process there, I would like to show you these three confluences where these are very important and where we use few things. Number one, in the community transmission, we use the testing. Number two, confluence, we use the remote care like telemedicine and some telephonic advice to the patients and who can take the home care. And from the home care, to go to the hospital, we use the ICU and then high dependency care and other hospital level care. The reason I'm showing you, because of this name of the session and the theme of the session that we are going to discuss today, we need technology. We need technology even to manage the health risk in the communities to the hospital care. And then on top of everything, in order to do this in a very good management and in a very good way, in a systematic manner, developing and using existing system, it needs a good governance. It needs a right time decision making. It needs to engage all the other people in the society and all other sectors, and not only health sector, that we call whole of society approach. This is important because this is how the global spread happens, and then global health security becomes very crucial. So before going to the next slide, I would like to show you some number, then you will understand that what it means. You can see that almost 29 million people are being infected till this information is still last night. So, and then when you calculate the death, it's about 1 million. So many people are actually recovering in many communities. This message is very important, that how we create this confluence of our health intervention, other sectoral intervention with the technology, and then we can save more lives and reduce the transmission. As I said, that it warrants a change. This change is from one approach that the world has been using to the other approach where world is getting benefit to save the more lives in the community, reduce the transmission, and minimize the health sector risk. So from the event-based approach, it's a good idea to go to the risk-based. So you are actually forecasting the risk and managing the risk. From the reactive situation, being very proactive, here comes a prevention and preparedness, and then proper response if your capacities are there to respond to an event, and that works very well. And as I showed in my first slide, that not dealing with the single hazard, but taking an all hazard approach. And instead of being hazard focused, we focus into the community vulnerability and capacities, and then taking the whole of society approach, and then shared responsibility, as I said, that with not being firefighting approach, but managing risk from prevention to response, and on top of everything, not planning for the community, but with the communities. And every step, you can see that how the technologies can be used. This is very important because all the countries, they need to achieve the sustainable development goal. For the health sector, the most important part is this one, the sustainable development goal 3, where it says strengthen the capacity of all countries, in particular developing countries, for early warning, risk reduction and management of national and global health risk. So you can see all the strategic approach, climate resilient health system, and then other public health guidance and agenda should be merged together. And this is how the strategic preparedness and response plan evolved to manage the pandemic. So based on all these global and regional available frameworks and guidance, you can see that, just to name a few, international health regulations, where many countries in the world, they signed it to develop the capacities to manage risk. Sendai Framework for Disaster Risk Reduction, Health 2020, Asia Pacific Strategy for Emerging Diseases. In order to have all these guidances implemented in the countries, WHO came up with the Health Emergency and Disaster Risk Management Framework. This framework helps the countries to implement all the risk reduction measures in the country for a sustainable preparedness approach towards resilience. This is another slide. I would like to explain what I just mentioned, that IHR, International Health Regulations, actually been used to attain health security in the community. And with the health emergency and disaster risk management, applying the multi-sectorality, all of society approach, community-based approach, links with the humanitarian response, it actually helps the countries to develop the resilient health system, which ultimately reflect into achieving universal health coverage, health resilience, and thus sustainable development goal. And as you all are aware, here comes a UN framework for the immediate socioeconomic response to COVID-19, which further reiterate this process, and everything towards a sustainable system, sustainable capacities, which we call sustainable preparedness for the countries. So what does this health emergency and disaster risk management framework have? As I mentioned, that the main vision of this framework is to improve health outcomes for people at risk of emergencies and strong community and country resilience. And then with this vision, there are some guiding principles. I'm sharing the link with you. I'm not going into details in the interest of time. And then you can see that some of the essential components, I am sure that you all can see yourselves in this. Like taking a risk-based approach, comprehensive approach across the emergency management cycle, all hazards, intersectoral and multidisciplinary collaboration, community participation, integration of health emergency risk management, and also ethical considerations where it comes the issue of inclusiveness, gender, rights, and everything. So who is doing that in the country? It's a confluence again of the communities, partners, and the World Health Organization around the health system and health sector, in addition to the support and engagement of other sectors. So basically, everybody is doing that. In WHO, for the pandemic, they established the epidemic intelligence from open sources. It's called EIOS. I'm giving this as an example that how technologies can be used in all such phases of this risk management. So from here, through this epidemic intelligence from open sources, there are 3 variables the countries are working and the WHO is supporting the countries. One is around the community, using the technology and building the capacities. And then there's some good examples that, how this happens, that in order to support the countries in listening, extracting the information, classifying the information, summarizing it, answering the queries, visualizing the information, and then share. This is very important. Dissemination of information from community to governance and also the other sectors and neighboring countries and to the world. So this is very important. This is where technology is helping, and then any innovation is helping the countries, because this is the way the countries can take the appropriate public health measures to manage the risk. These are some examples that how this can be used. Perhaps many of you have heard about Inform Epidemic Risk Index that estimates the risk for all the countries in the communities. Another example is Media Map for Emergency Operations Center, Case and Death Count Dashboard, and then also taking into account the public opinion, which is called infodemic, and also the information in the social media. So in addition to what I just showed you, that's how the ecosystem is being built, 3 things are very important. And WHO actually addresses those issues. One is this Go data, which is an epidemic platform for the monitoring of transmission. And then we have this infodemic issue that there are some misinformation in the social media and to the public, and WHO use one more approach, Mythbusters, to actually identify those misinformation and also to clarify those misintervention to the countries and communities. Some of the examples I would like to give you, that Mongolia, New Zealand, Colombia, South Korea, Thailand, and Papua New Guinea, they use some of the, way, like, these are that, what I just showed you, the risk management approach, all hazard, whole of society engagement, and the technologies, with the support of the technologies to manage the risk better in the communities, in reducing the transmission, reducing the death, and also make the most of it in recovering for socioeconomic recovery from the post-COVID-19 situation, and at the same time taking into account the concurrent emergency challenges. So that's the reason through this emergency and disaster risk management framework, using the technology, we promote these 8 issues I mentioned earlier, and then we really focus and then advocate with the countries to do this integration and partnership and find out the solution through innovation and technology. On overall, making it everybody's business, and that's how we will be able to respond to this current pandemic globally and not individually, and then engaging everybody, involving everybody for the sake of the community's improved life, improved health, and to reduce the death. Thank you, and over to you.
Thank you, Dr. Huda, for this presentation and the importance of good governance and the whole of society approach that you highlighted over your slides. Let me move to the next speaker on digital governance during COVID-19, Mr. Dennis Sousa, who is the Governance and Public Administration Officer in the Division of Public Institutions and Digital Government in UNDESA. Dennis' main research areas include e-government, citizen engagement, artificial intelligence, and other frontier technologies. Dennis, over to you.
Thank you very much, Anna. This is Dennis Susar from Digital Government Branch at UNDESA. I also would like to share my screen. Okay. I have a presentation online, and I will share the link later with the participants in the chat box, and Anna, I will also send it to you. I assume you can see my screen. Okay.
We do.
Yeah, thank you for the confirmation. So first of all, thank you for inviting us for this important event. There is a funny question circulating right now of a survey that asks, who is driving the digital transformation movement in your government agency? And the responses are Prime Minister's President's Office, IT-related ministry agency, CIO or equivalent responsible for e-government, and COVID-19. And of course, that's a joke, but there is a lot of reality in it. And during COVID-19, we are in a crisis, and sometimes it takes crisis to turn people's mindsets around. And maybe some of the government agencies or some of the organizations thought that digital transformation is years away, but it's actually happening. And especially during crisis, we are seeing an environment for rapid innovation. For example, even at the United Nations, we needed to fight so much to gain the flexibility of working from home, just 1 day a week for many years. But during the pandemic, we are all working from home now 5 days a week. And at least I can speak for our branch that the productivity increased dramatically. So things are happening during the crisis faster. That's my point. And also, this is a wake-up call for many government agencies that have placed too much focus on daily operational needs at the expense of investing in digital government and long-term resilience. So change is taking place, but there is still not a shared understanding of what digital transformation actually means. It stands for much more than suddenly working from home over Zoom. It asks governments to rethink how they deliver value to people in a digital world. And also, it's the process of using digital technologies to create new or modify existing processes, culture, and citizen experiences to meet changing requirements. So in our work in Digital Government Branch, we believe the COVID-19 crisis is likely to significantly accelerate the shift to digital and fundamentally shake up the digital government landscape. You can find our thought process in the two publications. E-Government Survey 2020, which is just recently launched with an addendum on COVID-19. E-Government Survey is the publication since 2001, where we assessed the e-government development of all 193 member states. And over the past 10 editions, it has established itself as both a leading benchmark reference on e-government and a policy tool for decision makers. I will not go through the details of this in the interest of time, but I will just mention the COVID-19 related work we have. So in yeah, these are the key messages from the global trends in e-government development. Still, there are gaps between the regions. You can see, but e-government levels have improved globally. So let me pass these slides, which are less important for this meeting. But compendium, we are working on a compendium of case studies where we actually asked member states to share their innovative case studies with us in April, May 2020 this year. And we received more than 500 cases in less than 2 weeks. And we went through these cases and we classified them according to these 9 areas you see in this picture. Those are information sharing, e-participation, e-health, e-business, contact tracing, social distancing and virus tracking, working and learning from home, digital policy and partnerships. Each section has a short descriptive part followed by cases. You just see the contact tracing apps here. So this publication will be out very soon in a few weeks time, and I will also put the link in the chat box where you can find it. So if I go to opportunities, how governments use technologies during COVID-19. First of all, I think we all agree that ICTs, information technologies, played a vital role in promoting the health and safety of people and in keeping economies and societies working during the ongoing COVID-19 crisis. So, for example, during the e-government assessment on March 25, 2020, where we had globally 416,000 cases, we've looked at all 193 national e-government portals of the United Nations member states. And we've noticed that only 57% of them had anything related to COVID-19. As the pandemic progressed, so as the e-government portals. And as you see in April, 86%, and May 13, 97%. And since then, we haven't done a test, but I'm sure the numbers are 100% now. So government portals adopted very quickly. And what kind of information we have seen here? Basically, it started with general health information, government portals. In later stages, we've seen COVID-19 statistics, and eventually we've seen the dedicated public COVID-19 portals, government supported apps, etc. So this just happened in a very quick time, and I can say that e-government officials have done their part in an agile development environment during the COVID-19. So you can see a lot of cases, for example, here in the bit.ly/ego COVID-19 apps. I will also put the link. But we've seen dashboards, chatbots, online services. I think in this slide, I summarized the most common applications we've seen. Contact tracing apps, AI chatbots as virtual doctors on government portals for self-diagnosis, which is very important because these are preventing the visits to hospitals which were overly crowded and which are still overly crowded in some parts of the world. Online permits, these are like asking permission to go out during the curfews via SMS or from an app. And of course, e-learning portals and working from home. So challenges, I just want to touch upon challenges very quickly. And I want to group challenges into 3 main categories. One is access, trust, and partnership. Some may see partnership as an opportunity, but I see it as a clear challenge in the data era because data is valuable and no one wants to share her data with other institutions. This can be between private sector and government or private sector people. So there is a challenge going on in the partnerships. Access, identifying challenges related to access is very easy. You and I have access. We are in this meeting, but nearly half of the world don't have access. So they cannot work from home, or their children cannot connect with their teachers and classmates. So while an estimated 4.1 billion people are using the internet in 2019, still nearly half of the world is offline. So we should never forget that. And you see here the map of the offline population highlights in regional differences in internet usage as well. And the access related challenges are also within the countries. So that's something between different social groups that needs to be addressed. For example, sorry, there was one more picture I wanted to show here. The gender gap actually in access is increasing. For example, since 2013, the gap between men and women have increased in developed countries, developing countries, and least developed countries. Yes. So trust issues, one of the challenges. During the COVID-19, we've seen many misinformation, fake information. Trust has many sub areas. So privacy, surveillance, data protection. For example, when the US administration assembled a range of technology firms, companies, and healthcare providers to establish a public health surveillance system in response to COVID-19 pandemic, some senators raised concerns that these public health surveillance systems may serve as beachheads for far-reaching health data collection efforts that go beyond current pandemic crisis. And this was everywhere in the world. They raised fear that further empowering technology firms and providing access to sensitive health information during COVID-19 pandemic could undermine health privacy. And I think a big concern is whether companies might build profiles of a person's health history, or another concern is that government might find ways to locate and track people with COVID-19 to prevent them from going into public places, for example, which is a interesting debate across the world. So we've seen a lot of fake news, and even the Secretary General of the United Nations marked on these fake news as the new pandemic, which you can read more in the compendium I shared earlier. So the partnerships, again, it is difficult, it is needed, and I will suggest this as a way forward, but government partnership with the private sector, like those sensitive issues between data collectors like Facebook, Google, and the governments is an ongoing debate, and we will have those challenges in the partnership for a while. So here, policymakers need to take into consideration the principle of minimization and limited collection, retention, and sharing of personal data. To what is absolutely necessary and rationally linkable to the purpose of overcoming the health crisis. Just simply, again, the issues are in partnership with data. So what's next? So in conclusion, I mean, it's clear that the pandemic forced governments and societies to turn toward digital technologies. So to respond to crisis in the short run, recover from and resolve socioeconomic repercussions in the medium run, and reinvent existing policies and tools in the long run. So this is a table from the UN government survey 2020 addendum. So digital government policy response to COVID-19. I will not go into details of it, but we've identified some policy responses in the short term, mid-term, long term, as I just mentioned. And basically these are a cycle. Again, after we reinvent, we need to come back again to the digital platforms, improve them, reinvent the same way private sector improves a product, a website. I mean, there is no way that governments will escape it in the future. People's expectations of governments have increased. They were already increasing before the pandemic, have increased during the pandemic, and they will expect the same level of e-services in the post-pandemic area. So policymakers need to respond to these rising expectations, continue to innovate and use digital technologies, but at the same time, there will be always concerns over privacy, misinformation, and disinformation, and they need to respond to this.
Thank you.
Pretty much that's my presentation. So thank you, and here is my email, and I'll give it back to you, Anna.
Thank you, Dennis, for sharing these very interesting links, applications, and also highlighting the access to internet and partnerships. We will have a full, complete session on partnerships on session 6. Thank you also for staying with us at so early hours in the morning in New York. Thank you. Let me move to the next speakers. Who will share the use of ICT in tackling COVID-19 in Korea. Mr. Dae-jung Lee is the Director of Development Finance Division at the Ministry of Economy and Finance in the Republic of Korea. Mr. Director Lee, the floor is yours.
Thank you, Anna. And let me share my slide first. Can everybody see my slide? Okay.
Very well, thank you.
Okay, very good. Good afternoon and good morning to participants around the world. It is my pleasure to meet you, although although I have to say only virtually. And like Anna said, my name is Dae-jung, and I'm in charge of development finance from the Ministry of Economy and Finance. And today I'd like to explaining about how the Korea responded COVID-19 with the digital technology. Just a second. Okay, this is the first slide, okay? And my presentation will be covered the following. The first is the current development of COVID-19 in Korea, and number 2, and how the Korea responded to the pandemic with the digital technology, and followed by the recommendation for the country. The first, let's look at the current status of COVID-19. And the first COVID-19 case was, as we know, founded in China, and Korea is located right next to China, but the virus has been spreading across the world, and I think there is no exception by the continent and the nation. And total numbers of confirmed cases around the world has surpassed 28 million. As of my number, and the number of deaths is over the 900,000. And we are also watching the resurgence of COVID-19, which we call the second wave in the country who has been tackled the initial spread. So even some country has seen as apparent success of suppressing the initial outbreak, they're also watching the additional infection rising again. This is a slide about Korea. And in Korea, the first confirmed case was reported in January 20th. And after that, we have witnessed the exponential outbreak began to occur in the cluster infection related to the particular religious region in Daegu and the North Gyeongsang province. If you see the slide, there is a red area, and this is where most of the initial outbreak has been occurred in Korea. The new confirmed case for Korea once surged to 900, more than 900 in February, but in only 20-day spread of a pandemic was brought down to manageable level, with the number of new infection falling below 100 in the March, and the Korean government lowered the social distancing level to the lowest level starting from the May 6th. However, with the latest research in COVID-19 cases in the metropolitan area, which is the Seoul and the vicinity, and if I can give you the brief background, in Korea is a very small land size. This is about the size of the state of New York, maybe a little bit bigger. It's only the quarter of size of the California. But we have more than 50% of the population are living in the very dense area of Seoul and metropolitan area, with more than 25 million people are living. And the government has strengthening the containment measures, such as raising the social distancing guideline, and also the public alert. So due to the measure, the number new case has been dropping gradually, but we are also facing the difficulty to containing, because at the initial stage of January and February, we have able to locate all the confirmed cases and their trace. But as the time prolonged for another 5 months or 6 months, we have a difficulty to contact tracing all the confirmed cases. And at the initial stage, we are able to contact trace about 90% or more. But now the number has been dropped to 80% or a little longer, which means that we are able to find all the source of their infection at the early stage. But as time goes, as the virus are spread at the community level, some of the infection we're having difficulty to how they get it, and what are the source of their infection. So it is still premature to let down guard against COVID-19. The Korean government will continue to marshal its power to thwart the pandemic. Nevertheless, Korea has drawn the attention around the world, and how the digital technology and ICT has helped to the virus without taking the lockdown, and without the ensuring the people's movement as well as economic activity. The main feature of a Korean response against COVID-19 can be described as the 4 T: testing, tracing, treating, and the transparency, as well as the participation. First is testing. Korea has increased its testing capacity at the very early stage of the pandemic by implementing the fast-track approval of test kit. In the meantime, the various methods for testing, including the drive-through testing and the walk-through, and also ensure the infection at the testing site, ensure the prevention of the infection at the testing site. Second is the tracing. The government has implemented rigorous contact tracing after carrying out the tests by developing epidemiological investigation support system, which we call EIISS. And I will come back to the epidemiological system in a little later. And the third is treating. To hospitalize the patient with a severe symptom and provide appropriate treatment option for the confirmed case, the Korea has been classifying the patient based on the severity and accommodating at the hospital at the treatment support center accordingly. And the last but not the least, the transparent disclosure of information about the public and also the general citizen is also the effective tool to tackling the pandemic, which means that if you disclose the information about where the contacts are and where they have visited in the previous few days, this gives you the alert sign to the general citizen to stay away from those sites and take a precautionary the measure, as well as making the common sense, because I think This is one of the key the Korea has been done without taking the the lockdown measure, and still we haven't taken the the nationwide lockdown to tackle the COVID-19. The government released the latest information on the prompt and the transparent manner, and through this, citizens are able to trust the government and voluntarily cooperate, and also restrain in visiting and going out the public site at the height of the the pandemic. Now I would like to move on explaining some example of how the Korea used the digital technology to contain the pandemic in the three areas. The first, in order to manage the people in the self-quarantine, mobile applications such as a self-check mobile application and self-quarantine safety protection mobile application were implemented. The self-check application allowed the user to monitor the possible COVID-19 symptom on their own using their smartphone. And all inbound traveler must install the app application and submit the self-diagnosis result for their next 14 days of the entry of the Korea. The self-diagnosis question covered checking the daily, the fever, whether you cough, whether you have any other symptom, and you can easily check the status, and public health officer can monitor them, and they see them as this is a possible signs of symptom. They're able to take the necessary measure to isolation and take them into the treatment center. In addition to the self-diagnosis function, self-quarantine safety protection application also has a location tracking information. Those in self-quarantine have to enter the address of their quarantine location into the app. If they leave the location, and the automatic notification sign is sent to the government official in charge, and give the alarm sign that to the necessary office. Second, tracing inbound passenger and their contact is an important part. The Korean government have introduced a smart quarantine information system. This utilizes overseas roaming data information to quickly identify inbound passenger from high-risk region and also monitor them accordingly. Third, as the COVID-19 case from the local cluster increase, epidemiological investigators suffer from the heavy workload. And this is another problem because there are not enough manpower to fully tackle and respond to COVID-19 outbreak. To relieve their burden and improve the speed and efficiency of contact tracing, the epidemiological investigation support system was implemented earlier this year. The system first collects the data from the GPS information and as well as the credit card transaction history, and conduct a spatial temporal analysis of the confirmed case. And this can be done within the 10 minutes. And usually it takes, in the past of the MERS outbreak, it takes more than 2 or 3 days. And in the past year, it has been taken more than the 24 hours, but now it can be done within the 10 minutes. And after that, public health officer in charge cross-check the epidemiological interview response of the patient with the data, and the system also detect the cluster infection based on the data. The next area is information sharing. The government has been sharing the relevant information in a transparent and timely manner. One example is the CBS. CBS called Cellular Broadcasting Service. The government sent out the emergency alert message simultaneously to millions of the mobile users visiting the local town or area. This message includes information on location that confirmed patients have visited for past few days. It is notable that CBS has its own channel that is separate from the general SMS or the text messaging service of a mobile phone, which can prevent the delivery bottleneck during the pandemic. So which means that even at the height of the public urgency, CBS message can have a the own channel to send the message to all the users of mobile phone. And moreover, company in the private sector have developed also the comprehensive situation map. This provides information regarding the patient's route and the location of hospital. And also another important factor is the wearing face mask. And this information also gives you the where they can buy the the face mask, and it also gives the daily stock. So if you visit a certain pharmacy or the convenience store, you can check whether those shops or pharmacy has enough stock for the face mask. This map is a typical example of public and private partnership, since it was developed based on the data disclosed by the government from the past pandemic of the MERS in 2015. The other area where information sharing was essential was face mask supply. And as I said, all the information on the daily sales and stock and availability is available to the general public. And this has been checked as a very transparent manner. And in Korea, we did not have much issues of the infodemic or the fake news, but earlier time in the pandemic, we have a high numbers of fake news regarding on the face mask, because everybody the rush to get the face mask. But we are able to also tackle or respond it by giving the real-time live stock information on the face mask, and this is also can check it in the using the mobile phone. ICT also played an essential role in facilitating the smooth transition to improve the social distancing. And government institution and the many business has helped start to adopt the remote working policy and environment to support this transition, the remote working. Within the short period of time, government launched a website providing the free solution and related to technical support. At the same time, to prevent the damage from the hacking and the ransomware while remote working, the government has developed the cybersecurity guideline and software as well. Since April, school began class using the remote learning. And to support this, and for your information, right now is some school students can go to the classroom, and some have to stay home and do the remote learning, and it's all depending on the level of infection and also level of social distancing measure announced by the Korea the Center for Disease Control and Health Ministry. To support this, the Korean government took prompt and action to ensure the stable access to online education system, which has been and also has been lending the PCs and computer to students for low-income family. So this is possible with a very smart and also the public and private partnership to providing the necessary computer line as well as the PC itself. Moreover, the government created online simulation software where the student can experience on-hand learning content in college and university. I'd like to go to the what are the lessons and recommendation for other country. Emulating the Korea's experience and how the Korea using the digital technology can be the very challenging task for other country, and this is not only difficult for tackle the pandemic, but also how to go back to the normal life using the digital technology will be also difficult the choice and task. However, Korea has shown some of the important lesson, and which we can share together. As I wrap up, I would like to outline the 3 factors that other countries should consider for the pandemic management in the future. The first, the government need to have a strong initiation in R&D for the digital technology. In Korea, rapid development of a test kit was possible due to the research and development investment over the past many years. So this is not done by the in overnight, and there has been the continuous effort need to be focusing on the research and development against the infectious disease and other health crises. The second, government have to leverage the digital technology for public communication channel and network. This might be difficult for from country to country, and however, there is a way to. Most of the country have the high level of digital access these days, and there is a message that you need to give the full information and without any distortion. And this is if you give it the information at the beginning stage, there might be some concern that it'll cause the public panic. But if you provide it at the solid and consistent manner, this is a very important way to to build the trust between the government and the private, and as well as citizen. And not the least, and you cannot do it alone. Government has to facilitate partnership between the public and private. And this cannot be done by the one side, and the state must work with the school and private company, and as well as other stakeholder, and as well as a networking company to to further advance their ICTs and the digital capability. And this is to conclude the presentation. And Korean government and my ministry has released 4 documents on the COVID-19 response strategy, and the beginning with general information and going into the more in-depth on digital technology, as well as in how we do in the remote education and remote learning, and also as well as the economic measure. Please if you have more interest, do visit this site, and you can download it for any time. And finally, and I think it's really thankful for the UNDRR for organizing today's session. And I never thought that there is my ministry is working on the the digital matter, but I think this is the unprecedented time, and everybody has to to come up with some new roles and responsibility. So hope this information can be useful, and maybe if you have more question, I can come back with some it's a Q&A session later. Thank you.
Thank you, Director Lee, for your presentation and highlighting transparency and participation, which is fundamental for good governance. I will thank you. On the Q&A, I see already questions in the chat box, which Mr. Sanjaya Bhatia will moderate the Q&A after the next presenter. Our next presentation will be about digital Bangladesh strategy during COVID-19 pandemic. Mr. Ramiz Uddin is the head of the results management and data in the Access to Information A2I of Bangladesh. Mr. Uddin, the floor is yours.
Thank you so much, Anna. Thanks for the invitation. And then, can you see my screen?
Yes, we do.
Thank you so much for giving. Just I will focus. I will be brief in 10 minutes. Within the 10 minutes time, I will try to focus on what innovation we had in terms of digital Bangladesh strategy. So I will focus on that. So if we look at this screen, COVID, how you have managed COVID in the country. There are some cases we had to come up with some innovation in terms of digital technology, in terms of data innovation. Our colleagues from UNDRR already mentioned about the data innovation, which was very important, and also whole of society approach and then whole of government approach, because to manage all these pandemic situation, you definitely need lots of partners to manage those. Yeah, that is very important. And if you look at all this slide, I will give you some cases. Then I will be brief, but don't hesitate to come up with a question, and then we can discuss. But how you have managed? Suddenly it came, but what is the platform you have that people can get information? So we had to come up with some kind of platform that
Ramesh, we can barely hear you, Ramesh. Yeah. Very low voice.
Can you hear me?
Yes, now it's okay. Yeah. Speak loudly. Yeah. Thank you.
Okay, a bit loudly. Okay. Okay, I can be a bit louder. Yeah, platform where we have all these informations available, like the platform with all this information. People can get people for the awareness, for the guidelines, for all kinds of policies. We had to develop within a short time. So that is the health guideline, daily media brief, and at the same time awareness content, voluntary doctors pool where people can contact, and at the same time COVID-19 tracker. We have developed people can get some information that what is the situation now, and emergency related supports and with the call center and many other things. But what are the things we have done actually here in Bangladesh? That is the lots of data innovation we had to come up with because of lots of data innovation, and at the same time also digital technology, and very closely working between health ministry and others ministry, and at the same time ICT ministry and also cabinet and then PMO. How we had this type of collective initiative in Bangladesh. It is not about for the health ministry. There is a huge workload within a short time. So data collection, data analysis, decision making, that is the big part of digital Bangladesh strategy during this disaster pandemic situation, COVID-19. Let me mention some of the initiative we had to focus on how to help a government in decision making. That is the human verification, and within a short time. So COVID is coming to Bangladesh. People will be contaminated, and there will be infection. But what is the suspicion and how it can grow, and how to suspect that, okay, within a short time it is coming, but what are the symptoms people will have in different location, and how it is spreading. If we try to look at that, and then if we try to that, okay, where it is these types of cases coming, what are the symptoms a bit higher in Dhaka, in crowded places, it is close to the airport. So you had to come up with this type of analysis. And at the same time, we try to identify through the call center that, okay, where are the locations that people actually have symptoms from the call center, and then we identified those areas, and then we provided some prediction to the government for taking the decision that how it is spreading. But at the same time, it is not about the suspicion, not about the concentration of suspicion, but you have to identify this all infected cases immediately using better technology like we had to come up with some idea like the telco data, how can we use, and some other big data, and to identify the red zones in different places. That is actually in what are the areas we have lots of red zones in the urban area, in the rural area, and we had to come up with some ideas that what should be the treatment, different types of intervention for the red zone and yellow zone. So you have to come up with some mapping, zoning, at the same time civil servants actually asking a lots of detailed intervention. It's like that. So in different area we had to come up with this type of, and the prediction daily cases and what should be the prediction, because in this we don't have this type of preparation at the hospital level and at the district level and or the sub-district level, we have to come up with the preparation. What should be the prediction level for 2 weeks, for 1 month, and how to prepare the hospital. So we have to come up with the prediction model. Do you have all these experts within the country? Do you have all this technology within the country? So you have to collaborate with the private sector, the telcos. You have to collaborate with the universities like Harvard and other universities to come up with some prediction model which is helpful for Bangladesh and Bangladeshi professors who are teaching in different universities outside of the country. Oh, then health resource management. That was very, very helpful in Bangladesh because we didn't have that types of innovation before that. Okay, what are the preparation needed in different location, in urban area and rural area, and also the different corners where cases are increasing, what types of preparation we need. So we had to come up with this type of innovation, data innovation, and we provided all this. So it is not like that. You are not managing pandemic at the same time. You have to think about the impact of COVID. So impact of COVID, you have to manage about health, other health, and about education, about economy, about social safety net, and also about broader employment and economy. Employment is a very huge issue. So you have to track that, you have to manage that. So immediately you have to come out with such kind of healthcare and PPE training, all kinds of arrangement we have to do. And that we have to do basically with the digital technology because it is the efficient way to reach the people and provide services during this situation. And how to recover all these SDG, Sustainable Development Goal, and how to prepare with all this impact. That was the one. That is, and we had at the same time and food insecurity. Food insecurity you have to assess in different locations with the technology, and then you have to provide all these type of services. Education, you have to come up with some innovation like that. How can we save education in different location at the same time, and connectivity challenges we have in Bangladesh already. Our colleagues already mentioned that half of the people don't have access to the technologies like the connectivity. So we have this type of challenges. Still, we are providing support to the education with the technologies, and then they came with some lots of requests, and this is government is managing. And about the e-learning in platform, we have to come up with several platforms to provide services to the teachers, to the students. So that types of to save quality education, that is the goal for. So we have to come up with lots of, that is for the student and for the teachers as well. And we have to come up, and our Prime Minister actually took lots of initiative and tried very good, and then with online classroom. And telehealth center, the challenges was that people are in quarantine, people are in isolation, but how to provide services to all these people, and at the same time, the people who are not non-COVID related health services needed, how to provide them. We had to come up with lots of innovation like the telehealth center and lots of call center support because people don't have in some of the areas connectivity, internet connectivity. So we have to establish that. So it is especially for the maternal child health. So we had to come up with some very good innovation which help a lot. That is 10 million people living outside of the country. If you look at that, that's a huge number in different locations. So you have to come up with some innovation like that. Okay, how to provide support to the migrant people, migrant Bangladeshis who are living in different countries. We have to provide that services with that one. And it is not like that. So it is also dengue, like dengue one. That is we have lots of disaster last time. That is non-COVID dengue, the communicable diseases. So in this area we had to come up with it, but you are giving services to the COVID patients and COVID related services, but about the patients who are infected by dengue? And so 100,000 patients we identified last year, but this year we had to provide these services to the non-COVID patient, but dengue, that is also a disaster for Bangladesh, but we had to provide that services. So in the COVID area, in also non-COVID area, we provided this type of services. But what about the partnership? And lots of private sector is full of society approach. Only health sector cannot manage that one. We have to, from the government, from the Prime Minister's Office, Cabinet Division, and all together have to work for the data innovation, for the digital technology, for integration of different technologies to manage all this situation. So we have to work with in the approach of full of government approach and also full of society approach to manage all this, and long-term preparation is really important. What are the challenges we faces? Data quality along with the format, and we already mentioned some of our speakers, and data research and capacities is really an issue. And data privacy, it was really challenging because people were not giving the exact location, and we had to identify using different technologies and data silos. Still, we have some challenges in Bangladesh, and we are breaking this rule with this. And data sharing interoperability, we have still some challenges, and we have already identified some of the areas. We have to come up with some ideas and then also come up with some innovation in the policy area related to data and data privacy. So health and data governance, that is the huge issue now in Bangladesh, and with the different culture, different dashboard, and different technology you have to introduce. And health service capacity development, that is the one issue. You have to provide lots of technology support in this area. And intra-hospital capacity coordination, both government hospital and non-government hospital, still data sharing is challenging. So you have to connect that one. Health financing tracking, that is also one learning area. We have to provide support. So these are the area we had in Bangladesh. Please feel free to ask question if you have. And you are also going to get this present PPT, and you can look at and you can coordinate. I also can share some of the links as well. Thank you.
Thank you, Ramiz Udin, for your presentation. Let me introduce Sanjaya Bhatia, Head of UNDRR, Office for Northeast Asia and Global Education and Training Institute, who will moderate the questions and answers to our speakers. Over to you, Sanjaya.
Okay, thank you very much, all the speakers. I have a couple of questions for Mr. Lee. Firstly, how do we bring technology usage in a manner that it is affordable for all without leaving anyone out? So this is more for, I think, the non-Korean context, and also how to spread it in areas where literacy levels are low. That is the first question for Mr. Lee. And the second one was about the privacy issues about contact tracing. So how do you ensure that the data is protected and remains private? Dr. Lee, over to you.
Well, thank you for your question, and I think this is really valid and important question we're all facing right now. And it's been quite some time that everybody is emphasizing the importance of digital technology. At the same time, some people and many people are concerning about the worry and the side effect of a digital gap. And we have witnessed that digitalization and the information technology are important to build new wealth and economic well-being. But I think it's one of the lessons we have been finding so far. And I'm sure after the COVID-19 is over and the relationship and and the causation between the levels of digital technology and the levels of the responsiveness of COVID-19. I think it'll take some time to find it out, those results, but I'm sure there will be a lot of the relationship, and also that if your country has a more high-tech abilities and technology, they're in better position to tackle the pandemic and health crisis as well. So I think this is not only the digital technology, it's not only issues of some rich country and or not. This is a common concern for the general well-being, as well as the lives and the health condition. So I'm sure there will be the more investment and also concern for the country to invest and also support in country in with the less digital capacity. And how can that will be the long term, but in short term, and it is not easy to bridge the gap of digital gap in the very short time. But however, you have other mechanism and also the way to spread the word. So if you have information, please do share in the using not only using the digital mechanism, but also the conventional way of announcement, regular news posts, and also TVs or radios, and keep alerting the people, because I think this is the faster or quicker and real-time information will be also the important way to not only to reduce the prevention, but also this is eventually a way to save life in some of the area. And number two, on the privacy, and I think I've been getting this question for many time, and I don't have a very clear-cut answer for the importance of contact tracing and the privacy. But if you do the contact tracing using the conventional way of interview and talking to the person and also asking the question, or using the digital way, which is there is access of the government or the health quarantine authority have access to your where you visited and where you're located, using the CCTVs and then also the credit card transaction, as well as the GPS location of the mobile phone. Contact tracing means that there is a government or certain authority have access to your location, or also know the where you visited, or where how many people you have contacted for past few days. So there is inevitably conflict the issues of privacy and freedom of the people. So whether you're using conventional way or whether using the digital way, I mean, without asking the private information or releasing the private information, there cannot be contact tracing. So number one is there is an issue that the contact tracing is inevitably have some infringe with the privacy issue. And number two is even if you are interfere with privacy, there should be the important thing is you do not share this information at the other way, and this information are kept in very secret, confidential way, so that cannot be used for any other purpose other than the contact tracing and other than the health and quarantine purpose. In Korea, this authority are born to the health and quarantine authority as well as the local government. And this system is only can be accessed by the very few people at the entity. So not everybody working in a government agency have access to the epidemiological survey or investigation system. And you have a double login system. So once you log in, some other people can also watch that you're logging the system. And after using this personal information, this information will be deleted automatically after the certain day. In Korea, 30 days after the investigation, this information will completely disappear. And another thing is you cannot use any other purpose other than the health and quarantine and epidemiological purpose only. And some people say this will be the great opportunity for the learning about the people's behavior and other thing, and also the social scientists as well as a researcher can be using this data will be can have a milestone the achievement on their academic field, but this is completely prohibited. So nobody can use the information collected, the contact tracing other than the the contact tracing itself. So there is a many mechanism, and lastly, this was built based on the legal framework, which means that after the 2015, the MERS outbreak in Korea, there has been the big controversy in Korea because we do the manual way to contact tracing, interview them, ask a question, and also sometimes the help of the public authority to to get the CCTV location. But what we learn is a lot of time that their memory cannot be perfectly clear, and sometimes that some people do not want to unveil their personal information, do not testify truthfully and tell the whole truth. And this causes a delay of time to contact trace them, and also delay means that other people inadvertently or accidentally pass by those sites get affected by the the infectious disease. So this is a serious issue that every government, every the authority need to go back and have a consultation. So this cannot be done without the general public's consensus, and also their legislative bodies about making the new legal law to help and give you right and authority to contact trace using the the digital technology. So, but I'm sure that every country will go back and to have an important lesson. And Korea is using this way, and we haven't seen the leak of information about contact tracing so far, because there is a very high penalty for the contact tracing official release or the leaked information. And we only know that only few people are having access to those, the information system. Okay.
Okay, thank you. Yes, of course, no system is perfect, but this is very, very close to perfect as possible under the circumstances. And thank you for explaining this so well. I also have a question for Mr. Ramizuddin about the community approach initiated by Muhammad Yunus of Grameen Bank. So the question is, does this help in the information dissemination, tracking, and reducing of impact of COVID-19? Dr.
Yes.
Ramis?
Yeah, thank you very much for this question. Yeah, this community approach initiated by the Muhammad Yunus and then also some other civil society organization, that was really helpful, because I mentioned about the whole of society approach in Bangladesh we have used to manage and this all to reduce this impact of COVID. So that was very helpful, but there are some challenges, how to visit and how to go, but BRAC and then Dr. Yunus organization. So all these had to visit in some of the areas, but it was limited. But that was very helpful and build confidence at the community level and how to manage those, because people were scattered in the beginning, but later when community level, this type of civil society organization visited some of the areas with information what we provided. These are the risk area and lots of symptoms we see in these type of areas. So that is why, and that community approach helps a lot. And at the same time, I also wanted to mention there is another question, that is we had 3 types of disaster at the same time. So that is the COVID, at the same time dengue, and also more than 3 weeks, half of the Bangladesh was under water. That is the huge flood. So you have to manage all this together, because you know about the food security, you know about the employment and other issues we have to manage, and we have to have very good documentation on that in Bangladesh, and that how to manage 3-4 types of disaster at the same time, so with the digital technology, and at the same time what types of preparation we needed to manage all this. But we had some partnership with Google. Google is developing one forecasting system for flood in Bangladesh, and at that time it was ready, and then we had to use that technology to track all this area and what will be the message, and then we had to provide message from the government system to the people how to save their resources and how to targeting the people who are in disaster. So that was a very good learning, and all these approaches are really effective. We have to have a very long term and very good plan, comprehensive plan in a whole of society approach. Thank you.
Thank you. I also have a question for Mr. Dennis Susar. How can, which are the, can you mention some best case studies for citizens' involvement in disease surveillance and monitoring using technology? Over to you.
Dennis just left the meeting.
Okay. So, so this is open to any of the maybe. Okay, so let me go to another question for Kutsia. Dr. Kutsia, this are the teams of personnel assigned to mapping the actual cases of the epidemic? Should they should they receive some training before they are sent out, and is there any criteria for such personnel?
Thank you, Sanjay. There are, like, WHO provides a guidance, of course, like, to develop the capacities of the data collection and then also evaluators and so on and so forth, particularly the people working in surveillance. There are quite a few technologies being used in many countries around the world. And then so far my understanding, and then the information we receive here, that many countries, they are organizing the trainings for that as well. So this is pretty much available. And again, like, this is, I think that one of our speakers from Bangladesh, he also mentioned that taking this training program online on the online platform, and then how to develop that capacities in the communities. So this is, yes, this is pretty much there. Over to you.
Yeah, and another question, Dr. Kutsia, for you. So do you think there, could you mention, or can you recall any good practice or case where citizens were involved in disease surveillance and monitoring using technology?
Well, I would say that actually in my presentation that I shared, I mentioned some of the countries that they use, that the community is quite heavily involved in doing so. So I can give an example of Colombia, where they use a tool, it's called Medellin Me Cuida, and which is like, Medellin takes care of me. So this is a very simple app, and that they are using so that the community can provide the information, take part not only in surveillance, also in planning and other risk reduction approaches. And then at the same time, there are other, I think that New Zealand is a good example. Our colleague from South Korea also provided a good example. And then again, the other example would be Thailand, where they're using this social protection of vulnerable population through technologies and different apps. And then, I mean, that might not be a very good success story, but another example is the app, like, contact tracing app they're using in many countries, including the United States. Over to you.
Okay, thank you. There's another question from a colleague from Peru about, is there any, I think probably a training to help manage a complex crisis, especially natural disaster and pandemic. So any protocols or trainings for that provided by WHO, for example?
Sorry, say it again, the question, please.
Any training or guidance available on how to manage complex emergency, meaning natural disaster and pandemic both together?
Yeah, thank you, sir, Sanjay. Yes, the WHO actually, in the middle of the pandemic, WHO issued health advisories. The first health advisory was issued that how the countries can actually prepare their system for other emergencies like natural events, cyclones, floods, earthquake, and everything in the middle of the pandemic, and taking the measures, public health measures for the pandemic as well. I mean, particularly highlighting the need for such measures in the shelter, different shelters, cyclone shelters, and then others for the population that they are being displaced from such emergencies. And then currently we are issuing the second health advisories, how the countries would actually get prepared for the extreme temperature events, like in extreme heat or extreme cold in the middle of the pandemic. And then in these advisories, we provide the information and then guidance that from starting from the governance till the community, starting from the assessment till the implementation, capacity building, what are the measures should be taken into consideration so that the system can be robust enough to respond to all the emergencies the country is facing to. The colleague from Bangladesh gave an example that currently Bangladesh is facing 3 emergencies, pandemic, dengue, and also flood. I think that this is a very good example. He demonstrated that how this information, all this information can be packaged together and can be used for the decision making to develop certain capacities in the community. Again, I reiterate that this is a very good case to show that how the whole of society can be very instrumental, not only developing the capacities, but also addressing the issues and challenges of many emergencies in a complex situation in any countries. Over to you.
Okay, thank you. And last question for Mr. Lee. It is the self-quarantine application. Was it developed by a government agency or was it in partnership with the private sector?
Our answer is very simple one. It is developed by the government, and this is the reason is I think there is a lot of information is located and stored on the application are very sensitive issue. So this is only the government application, and they have access by the public health officials and agencies have access on those information.
Okay, thank you very much. I think this brings us to the end of the Q&A, and also I thank all the speakers for their support in this, and for showing all the good practices and the guidance and answering all these very interesting questions. In the chat, I've also put there the WHO Open. That is a link which can take you to a large number of courses and guides. So do have a look at that. These are all related to various kinds of health emergencies, especially, and also the current one. So have a look at that. As we are a bit short in time now, what we have planned is we probably won't do the group work, and we go into this the next presentation, which I am doing on the public health scorecard, and then let's see how we are with time. We might have a few question answers again. So next slide, please. So this slide, what we are trying to say is that resilience is a long-term process. So it can take decades. There are some actions which can be done in years. There are other actions which can take months or weeks or hours. So it depends. So in this slide, we are showing different types of actions for achieving resilience. For example, evacuation, securing the property, event tracking, that's in days to hours, hours to days. But if you look at building code revisions or building public awareness, that can be exercise which goes into years. Next slide, please. And in the next slide, what we're trying to show is the same concept, but for the health. Again, contact tracing for the cases, hotspot detection is something which can happen in days, in hours and days. But when we look at pandemic planning and simulation, for example, that is something which can take years. And then on the other side, rebooting business after lockdowns can take months. So what the idea of these slides is to show that resilience is not something that we can achieve very quickly. It will take time. The impact will come over time, but that should not discourage us. It just means that we should be committed for a long term and gradually, step by step, taking small baby steps, move towards achieving greater resilience. Next slide, please. So, and click it two more times. This is just to show that resilience is as between the national and the local governments, the relationship is very strong. The national government can provide instructions, they can provide data, they can monitor a big scenario, the big picture. At the local government level, there is a lot of data is created. And then the bottom up from the local to the national is again the going to the feedback and providing the data. Next slide, please. And this is with the, again, click twice. This is with the with relation to the health situation. So, for example, the government can provide instructions on business opening, both the national and the local government, on guidance on how to on the symptoms, how to stay healthy, where are the treatment facilities. The community plays a role in contact tracing, as we have just discussed in the Q&A also. Again, using that information and data, the government can do the centralized contact tracing. It can answer the questions, provide the frequently asked questions to the people, provide information, and so on. Next slide, please. So, and there is a global campaign called the Making Cities Resilient campaign, which has 4,300 cities signed up currently. And this is a new initiative under this campaign is going to be launched very soon, which will last till 2030. But this campaign has been running since 2010. And one of the important tools there that the campaign has developed is this disaster resilience scorecard for cities. And I think one of my colleagues, the link is here, so you can download this scorecard. It is available in 13 languages. So go to the website, see if it's there in your language. Otherwise, you take the English version and download it. It is easy to use and it is self-explanatory. Basically, it helps the city government to understand where they are as far as resilience is concerned. And sorry, it also helps the government to decide what kind of actions they need to take to increase resilience. Next slide, please. So the campaign has broken down the Sendai framework for DRR into 10 essentials. And if you read, the points, the organizing for resilience, understanding the risk, and strengthening the financial capacity, and so on. So these are all the logical key areas of work that any government should do to enhance resilience. So the resilience scorecard has some mention of the health sector, but not very comprehensive. So next slide, please. So because of that, another tool has been also developed, and what the scorecard does is also look at the underlying chronic stresses. So and especially when we see the current pandemic, the COVID-19 situation, where there are inequities, there is not there is exclusion as opposed to inclusion. There we see the impact is much more, and that is because of the underlying causes, which can include poverty, low levels of nutrition, low levels of healthcare, and so on. Next slide, please. And so that's exactly what I was just explaining. And then what we see is that the pandemic, of course, is not only the health department's worry. It is something which impacts livelihoods. It impacts small, medium, and large businesses. It impacts unemployment. It impacts public transportation. It impacts supply chains. So all of these enhance poverty that already exists. So already the World Bank has done a study which says that a large, in millions, people are going to move into poverty because of this pandemic. And so we need to see the interaction of disasters, and especially pandemics, with our economic systems, which COVID-19 has demonstrated very clearly. Next slide, please. And we also need to understand that any government, especially a city, is a system of systems. So responding to a disaster, or preparing for a disaster, or mitigating the risks of a disaster are not the work of only the civil defense or the emergency management department, or in case of pandemic, the work of the healthcare department. It is the work of everyone, because everyone does get impacted by anything. So even in this pandemic, for example, we see fuel prices have come down, and many companies which were in the oil business are saying that they are reaching what is known as peak oil. That means peak demand for oil is coming earlier than before, and earlier than anticipated. So what it means is that there are going to be long-lasting impacts, and we have to understand how a change in one of the system will impact all other systems. Next slide, please. So there is the scorecard, as we already I talked to you about this already. Next slide, please. And in the scorecard, these are some of the. This is what it looks like. It's in a PDF version and an Excel sheet, and these are the kind of questions it asks. So, to what extent are risk factors considered part of the strategic plan of the city? And there is a scoring 0 to 5, 0 being no, nothing, and 5 being best case scenario. And then there is a place for comments to explain further. And as you see, if you see 1.1.2, is the strategy inclusive? And here it includes the local health sector. So the local health sector, in the comments you can see, is also considered an integral part. Next slide, please. So when we try to look at managing for health emergencies, we have the WHO guidance on health emergency disaster risk management. We have the health scorecard, and we have the disaster resilience scorecard. So all three can interact to create a scenario by which local governments can manage things better. Next slide, please. So now the health scorecard, which is different from the resilience, resilience scorecard, which is for the entire city. The health scorecard is also for the entire city, but has a specific focus on health issues. It does not mean it is focused on the health sector. It means it is focused on health issues, which cross all sectors. So, for example, it will cover not only nursing homes, the public health emergency, drug treatment, laboratories. It will also have a role with the elected officials. It will have with the public transport, with the neighborhood organizations, with the schools, of course, with the doctors and hospitals, the non-profit organizations. So all of these become interactive and interrelated because of the situation, and the pandemic we face currently exposes this very clearly, and the health scorecard tries to look at that. Next slide, please. So what the health scorecard covers, and can you just click twice? Some of these are, oh sorry, yeah. So some of these are very much related to the pandemic. All kinds of issues are covered, including pandemic outbreak is included in the risk scenarios or not. So this was, of course, something which was missing in most situations, as we see now in hindsight. Just click again. And whether there were sufficient skilled health professionals to maintain public health during the disasters. And we have seen this not only supply chain disruptions, we have seen shortage of doctors and nurses in many countries, and equipment and technicians and even medicines. So, so the health scorecard does address these questions and flags them so that the government can think about them and see how they can better respond to these situations. Next slide, please. Again, some more which are relevant. So just click twice. So these are again related to the pandemic. For example, surge capacity. So we have seen in many countries they have adopted, they have created temporary facilities for quarantine, temporary facilities for treatment. They have tried to redeploy doctors and nurses and technicians from other areas. So all of these systems are very important. Next slide, please. Next, please. So this is a sample from the page, from a page of the health scorecard. So questions such as, to what extent are emergencies and disasters, including disease outbreaks, included in the risk planning? So, and then 0 to 5 again, 0 being no, and 5 being best case scenario. Next slide. And this is about the availability of health workforce. So to what extent are the workforce and the skills required available in the city? And 0 to 5, 5 being all relevant workforce competencies and skills are available. So this is, and there's some comments from the WHO guidance on what is considered healthcare professionals. So it includes not only the doctors and nurses, but also psychiatric care, care home staff, nursing homes, epidemiologists, testing staff, supply chain workers, pharmacists, and so on. Next slide, please. And then this is the question on the surge capacity. So I would suggest that after this session is over, because we're not able to do the group work, but do download the scorecard and look at at least these 3 questions and see or try to, it's not many, it's about 25 questions. So you can go through it quickly, make a hypothetical situation of the place where you are, and just mark it and then see how it works out. Because take it down in the download it in the Excel format, and then you will have the analysis also come out automatically at the end. So I would suggest do that. before we meet next Tuesday. Next slide, please. So this is where it's available, and it is currently, this is the link you can download from, and it is currently available in English, Arabic, and Spanish. Next slide, please. And this is the approach you can use to use the scorecard to develop a health action plan. Very simple, but through a workshop modality, we're bringing together all the key stakeholders. So meaning not only the health department, but all the others, the finance, the planning, the public transport, the electricity, the school education, the infrastructure, utilities, and so on. And then work through the questions. The questions, the answer to the questions will expose the gaps. And then you know what actions you need to take to cover those gaps, and that makes the action plan. Next slide, please. So this is a typical workshop agenda of can be done in 2 days, can be done in 3 days. Next slide, and that's the last slide. And so this workshop agenda of 3 days means you do the scorecard first, then you do the health scorecard, but you can go directly into the health scorecard. And that's what I advise after today's session. When you have time, just download the Excel sheet and go through the 25 questions with the hypothetical situation and see just to work it out. Next, and that's the end. These are the key resources. You are free to use them. And with that, I end my presentation and then hand over to Anna. Thank you.
Thank you, Sanjaja. Questions for Sanjaja, please? Any question? We have a few minutes still with Sanjaja. If not, if any question, yes, we have the scorecard addendum, public health addendum in French available. It's in the same link we shared in the chat and Sanjaja mentioned in the presentation. And yes, all presentations will be available in the UNDRR webpage for this event and in the UNPOG event in the workspace. So there is one question, Sanjaja. You see in the chat?
Yeah, I think this question has already been answered by Dr. Kudsi. I had asked her and she has answered this. They have talked about the best practices of citizens' involvement in disease surveillance and monitoring using digital technologies.
Okay, so it is not related to the scorecard presentation of Sanjaja. Sanjaja, thank you very much for your presentation and for moderating the Q&A. And we will move on the last presentation, very short, from our colleague, Sara Weida-Pichela, who will introduce us to our next session, section 6. Sara, over to you. Sara, you have to unmute yourself.
Apologies, I was having a challenge to reach the unmute button. So thank you all for your very active engagement throughout today. And as you know, this is our 5th of 6 sessions, now coming to a close. And I think today, one of the really hot topics, if you will, that has come up is really the importance of partnership. And you'll know that our session next week will actually focus on the innovative experiences in partnership building required for risk-informed governance and the use of technology. And I think we have heard many of the challenges and opportunities. And indeed, we heard from our speakers today that the partnership really includes and extends to the all of society approach, that it takes technology, it takes people, it takes process from universities, UN, government bureaus, citizen groups. It really takes everyone. And in particular, during the COVID crisis, really reaching the health sector as different partners. So it is really critical, in fact, that we discuss our partnerships and what are those innovations. So next week, next slide, please. We will look into what are some of the innovations. So for advancing government innovation and leveraging the frontier technologies, we know that it requires strengthened, diverse, and innovative partnerships, as we've heard today. So this next session is going to explore some of these innovative experiences and partnerships, drawing on experience from government in engaging with UN, with civil society, with scientific and technological bodies. It will draw on experience looking at private sector engagement, including from entrepreneurs and startups to scientists and researchers, particularly youth, and looking at some of the ways that technology is an enabler and a tool for these partnerships. Next slide, please. So the learning objectives and content for next week will focus on understanding and making the case for the multi-stakeholder partnership as essential for our risk-informed governance mechanisms. So really emphasizing all of the other actors and partners, some of whom you may not have considered might need to be at the table actually in the governance process, in the planning, and understanding needs and in taking actions. You will also get ideas on how strengthened, diverse, and innovative partnerships and the use of technology will then strengthen these mechanisms of governance for practical action. And you will learn more, you'll know more about some of the existing stakeholder mechanisms and multi-stakeholder mechanisms, including networks and innovative collaboration platforms, how and where to join. And we will invite our speakers to share resources. Next slide, please. So we will begin next week with a brief introductory presentation, drawing from our toolkit, but also providing you an overview of some of the UN stakeholder mechanisms for disaster risk reduction and sustainable development, ultimately for risk-informed governance. And then I will moderate a panel. We will have panelists coming from government, youth science, on the topic of public-private partnership, entrepreneurship, and startups for social good. We will also hear on citizen engagement for risk-informed planning, and we'll look at the science policy interface, research uptake, and evidence base. Next slide, please. Following the panel, we're going to move into the way forward session. So again, next week is our last session. We would very much like to invite your feedback, and we will have a moderated discussion by my colleague, Mr. Capignao from the UNDESA, DPIDG, and UNPOG, who will be seeking your participant feedback both on this course, but also to share some of your country experience. So please do think about what you would like to share, come prepared, and we'll invite your comments in this moderated discussion. The closing remarks will be made by Sanjaya Bhatia as our head of the Global Education and Training Institute at UNDRR, and also Mr. Bokyun Shim, who opened our session back in session 1 and has presented as well from UNPOG, DPIDG, and UNDESA. Now, next slide, please. A very important aspect of your feedback that we're now seeking is actually on the toolkit itself. So we are seeking your review. We would like your comments. I think some of you have been using the toolkits that we have provided you during this course, but you know there are very many more resources, more cases, and more guidance available in those toolkits. So the toolkit is available within the workspace, as you know, and we've also made it available at this Google link. And we have developed a quick survey form, so you can please give us your feedback. What's most useful? What's maybe less useful? And how might we improve? And certainly if you have any cases that you think might improve the toolkit, we would like to hear those as well. So the structure of the toolkit, just as a reminder, is there's a module 1 that includes 3 parts on science, technology, and innovation in public governance for DRR and resilience. Module 2 on the practical and planned application of emerging technology and innovation. And here you have 5 modules with many cases of the use of technology. And the third module on implementing the emerging technologies and innovation for DRR and resilience. So please do have a look, and we will welcome your feedback, and we very much look forward to your participation in our last session, when we will also inform you how you will get your certificates of participation. So I think we had a really rich dialogue today. We've had a wonderful number of questions, and we thank you, and we look forward to next week and continuing the discussion in the online workspace during this week. So thank you very much, and that concludes today's session.
Thank you, Sarah, and goodbye, everyone.
Thank you, everyone. Have a great morning, afternoon, or night, wherever you are. We look forward to seeing you next week.